Orleans County, New York is a beautiful place to live. Here we can enjoy a peaceful rural life with picturesque pastures, woods, and lakes. The area is rich with history and home to some of the best fishing in the world. Local farms and home gardeners make fresh and healthful food abundant to support healthy living. But what happens when we need healthcare services that are not available in our area? When the Orleans County Health Department surveyed the community, they learned that we are concerned about chronic health conditions like cancer and heart disease. We are also concerned about stress, mental health, and substance abuse in our community. We want to become active members in our healthcare, but oftentimes in a rural area, the right healthcare provider is just too far away to reach. On average, there are 70% fewer specialists available to us in a rural area than to some living in the suburbs or city. Meet Jane. She's the busy owner of a restaurant. Jane recently visited her doctor, who suggested she see a dermatologist about a mole that may have changed. Jane's doctor wants to make sure Jane does not have skin cancer. Jane has been putting off making this appointment because the nearest dermatologist in her insurance network is 2 hours away. She doesn't have the resources to be away from her business that long. Now let's meet Miguel. Each spring, Miguel and his family travel to the area to work on the local farms. Miguel works hard to provide for his family, and the workday is long. Recently, he cut his hand while working and is concerned it might be infected. He is worried about losing a day of work to see the doctor. And then there's Fred. Fred is an active senior citizen who loves his farmhouse and family. Fred's family worries about him being home alone because he struggles with diabetes and heart disease. Sometimes Fred forgets to check his blood sugar and take his medication. Dr. Nancy is a family practitioner at the local health clinic. She is one of the 10% of physicians who practice in rural America. There are so many patients to see and so few resources. Dr. Nancy is frustrated because she often refers patients to a specialist, but they do not make the appointment due to lack of transportation. In addition, she is very concerned that patients have expressed dissatisfaction over long waits in the waiting room. Many have been turning to the emergency room, where services are very costly. There must be something we can do to get access to healthcare in a way that works for us. For many of these situations, telemedicine can make partnering our own healthcare easier. We use computers and mobile devices to manage many aspects of our busy lives, so why not our health? Telemedicine is the use of electronic communication to improve health outcomes. It uses tools we are familiar with, such as video, email, the internet, and smartphones. This can be convenient, as a 2015 Pew Research study found that 2/3 of Americans use a smartphone. There are different ways that telemedicine can be used. A patient can make an appointment with a provider for a non-emergency visit and receive care in the comfort of their own home. Miguel could visit a doctor online to see if his wound can be effectively treated at home. A primary care doctor can consult with a specialist without sending the patient far away. Jane's doctor could take a picture of the mole she is worried about and consult with an expert dermatologist at the University of Rochester to better determine what action is necessary. Telemedicine offers Dr. Nancy an unlimited network of specialists to collaborate with, so she can provide better care to her patients. When patients have the option of a home visit for a contagious condition, such as cold or flu, the waiting room will be less full and the risk of spreading illness to others is reduced. Another way that telemedicine can improve outcomes is patient monitoring. Fred sometimes forgets to test his blood sugar. His family worries. With telemedicine, Fred could wear a special device that can monitor his blood sugar or other vital signs. This information can be transmitted to his provider to provide early warning signs that Fred might need a reminder or some assistance with his care. Telemedicine brings access to healthcare services to those in distant locations. It enables health providers to work together to make people healthier. Telemedicine enables health providers to reach more people. Telemedicine reduces the cost of healthcare, it is efficient, and has been proven to reduce hospital stays and readmissions. Patients save the time and expense of having to travel long distances or miss time at work to see a specialist. Studies have shown the quality of telemedicine services to be equal and sometimes better than traditional visits. Many insurance providers are beginning to cover telehealth. Medicare reimburses many telehealth services in rural and health professional shortage areas, such as Orleans County. Telemedicine supports our busy lifestyles. Ask your healthcare provider or your insurer about telemedicine options. In addition, you can explore private telemedicine providers online. It's our health. Let's start caring for it in ways that work best for us. Telemedicine is care when you need it, where you need it.
created using Powtoon.